Mr. Chairman, and I want to thank the chairman and the ranking member and the staff for working with me. I'm not on the subcommittee, but working with me and also with Ms. Roybal-Allard on getting some provision in this, some language in here regarding prenatal screenings, which is really important to me. A non-invasive prenatal screening is a maternal blood test, and it examines fetal DNA in the maternal bloodstream to see if the baby is at risk for some sort of a chromosomal abnormality. And I was shocked to discover that doctors are not always explaining the limitations of these screenings as one of the fastest growing applications of genomic medicine, which holds a tremendous amount of promise. Unfortunately, these tests can generate confusion for patients and healthcare providers about the meanings of the results. A screening can detect a potential problem or a likelihood of risk, but it's not reliable enough to diagnose a chromosomal abnormality, a genetic or life-threatening condition. By definition, it's a screening, not a diagnostic test. And some companies that produce these screenings have muddled the understanding of screening results by overselling their accuracy. Two recent industry-conducted studies reveal that high-risk warnings for babies' chromosomal abnormality or for babies' chromosomal condition can be false about half the time. In another study, samples from 2 women who were not pregnant were sent to 5 testing agencies for 5 testing companies for analysis, and 3 companies returned results telling them that the women were carrying a healthy baby. So it's crucial that expectant mothers have full, accurate information about the screening and what it can and cannot tell them. They need to know the potential benefits of taking the screening and the risks of relying on the screenings alone. So I'm pleased that the report language includes a provision to address this issue. The provision requests CDC through National Center for Birth Defects and Developmental Disabilities to assess and evaluate the current healthcare provider and patient education activities related to the prenatal screenings. There is not a good standard across the nation. It's really applied unevenly. And so we're asking the CDC to get involved. It also requests a report on CDC on how CDC and other HHS agencies ensure patient and providers understand the accuracy and or the limitations of these screenings. So this is incredibly important to me. I thank you so much for including this in the bill, and with that, I yield back.